everybody. I'm Commissioner Danielle Bethell, and I'm here with some of my colleagues who are going to introduce themselves in a second. Because we as a Board of Commissioners want to be more present in your understanding as to how we're navigating some of the service systems in Marion County. And today we're going to be talking about House Bill 4002 and the public safety system. And Commissioner Cameron's going to do some of the moderating, but before that, I would love each of you to introduce yourself, starting with the DA.
I'm Paige Clarkson. I'm the DA of Marion County.
I'm Nick Hunter. I'm the Marion County Sheriff.
I'm Colm Willis. I'm a Marion County Commissioner.
I'm Kevin Cameron, one of your Marion County Commissioners.
And I'm Ryan Matthews, Administrator with Marion County Health and Human Services.
So one of the things that you can do after this video is at the bottom there'll be a website that will take you to the Commissioner's blog. We also air our weekly board sessions on CCTV and our Facebook live stream so the public can engage with us along the decisions that we're making on your behalf. And with that, Commissioner Cameron.
Well, thank you. Can I call you Danielle for this video?
Absolutely.
Ryan, Danielle, Paige,
Of course.
Nick, Colm.
No one's going to tell you no. Just do what you want.
We're gonna get right to the soul of this thing. So, well, I guess what I would like to ask, and maybe I'll start over on this side. Why do you think we're even here talking about this? Can you go back and give us a little bit of history why we're here today?
Well, I'll jump in.
Sure.
I think we all know that the voters several years ago approved Measure 110, which legalized what most of us would historically think of as illegal drugs. And since that time, we saw a significant rise in overdose deaths. Unfortunately, I think the proponents of that measure thought that it would result in more treatment for folks who were struggling with addiction. And in fact, we saw the opposite. We saw fewer folks getting treatment. We saw more real sad situations on our streets, frankly. We saw people not getting help, people dying, people overdosing. We saw a lot more crime on our streets. And so this body and other bodies like us asked the legislature to change that law, to reinstitute criminalization of illegal drugs, what I would consider illegal drugs. And the legislature did that. They passed a bill called House Bill 4002, reintroducing criminal sanctions for the possession of narcotics in our community, on our streets. I think that was a good thing. But that's not the only thing that House Bill 4002 did. It did a lot more than that. And I think really the hope for us here is to educate our community about what are the other things that House Bill 4002 did, how it's getting people into treatment, how it's making our community safer, and how we're implementing it here in Marion County.
That's good background. And Paige, maybe I described this as I think I just said it this morning, where it's not like we're flipping on a light switch here. We're actually kind of just turning up a dial with these programs. Can you share from your perspective some of the processes that you've been going through at the district attorney's office and how it's impacting you? And
Sure. I think that dial analogy is a good one. It's a lot easier to break systems than it is to build them back up. And what we saw under really good intentions may have been, the reality was it was harming our community members. It was breaking our social nets and social systems we had out in our communities. We just could not respond to the demand that was out there for illegal drugs that was unchecked. And it was unchecked in a number of ways. And with 4002, with that House bill, what we did was gradually start to take steps to make our communities healthier. It did it in a couple of ways. It did recriminalize what we would consider hard street drugs. So that's everything from methamphetamine to cocaine to heroin to fentanyl, which I think is on everybody's mind as really the culprit for just killing our community members out there. But it recriminalized that. And what that did is it made it very less hospitable for people to use and abuse drugs in our community. Under ballot measure 110, we kind of rolled out a red carpet and welcomed drug dealers and drug users out into our street. And so it created this unchecked addiction that really everyone could see. You only had to look out a window in any one of our larger cities across Oregon and recognize what was happening. House Bill 4002 makes it less hospitable to do that out in our streets. What it does is reintroduce law enforcement, pointing to our sheriff here. It reintroduces us into the equation as people who can step in and help, as not a barrier to treatment, not a barrier to the services that might be out there, but a bridge. And in Marion County, we've been doing that really well for about a decade with our LEAD program, Law Enforcement Assisted Diversion, which we're always happy to talk about and tout and brag about. But under House Bill, or under the ballot measure 110, we had a lot of challenges getting law enforcement into that equation again. 4002, that House bill allowed us to reinsert law enforcement into the conversation and get folks help, because law enforcement officers were able to actually even converse with them, be on the street. Puts us back in the conversation as prosecutors, because again, we can use our systems and our programs to give people that carrot or the stick, that motivation, whatever it is, to try to get towards healthier lives. And that's really the simplest version of what it did.
Danielle, you played a huge role in the legislative fix of this, going over and testifying. And what were some of the things that you thought were really important? And how did you work with the legislature to help? I mean, there's a lot of partners that put this together. Absolutely. But as a county commissioner, you went over and did a lot of work on this. So
yeah, so I performed as the president of the Association of Oregon Counties during the end of 2023 and as until about 2 weeks ago in 2024. So I had the privilege and honor to be front and center working with all counties across the state of Oregon and the Oregon Sheriff's Association and the Oregon DA's Association to be present in the room with the Oregon legislative leadership to help them be educated, first of all, in the role of counties, the work that we do, that we're statutorily required to do, the role of county commissioners and our statutory authority, and really design how the system could function without it being imposed on us. The original outset, intent was that some really creative legislators who saw the break in the systems thought that they could just design something and force it on us. And I was in a very well-positioned space to walk in the building and say, no, that's not how this is going to work. You need to come to the experts in the industry and have us at the table and understand what we can and can't do. And we didn't get everything we wanted. It was extensive negotiation. I would say in the political sphere, neither party, Republican or Democrat, were ultimately happy with the overall outcome. But it was the first time that the Association of Counties had the ability, frankly, and the authority to walk forward into that building with our partners at the Sheriff's Association and the DA's Association and say, without us, this won't happen. And they eventually took that seriously. And it was about a 48-hour turnaround when some legislation quickly changed in some wording. And it wasn't just me. It was also Paige Clarkson and also Nick Hunter. Right. It was the Marion County leadership team. Yeah. I would say we're most geographically positioned because we're a block and a half away from the Capitol. But also each of us are leaders in those associations and really carried the baton for the outcome. And we still have a lot of work to do.
Yeah. I think it's important what you just said. As we always say, there's 36 counties in Oregon. If you've seen one county, you've seen one county.
For sure.
They're all different. And one of the things that I think, Paige, you were talking about was law enforcement re-engaging. And Sheriff Nick, do you want to share how you're able to do that and what steps that are happening now as a result of House Bill 4002?
Sure. I think actually to go forward, I'm going to go back first. I'm going to go back to what Commissioner Willis was talking about. And we do spend a lot of time talking about overdoses. Yeah. But this is not just an overdose issue. This is also livability, and livability through an increase in theft, an increase in trespass when we talk about homelessness. All of these things became a challenge for law enforcement because I can certainly arrest somebody for theft, but just taking that person to jail and not treating the underlying problem or the root issue of that drug addiction, they're going to continue to do the same thing as soon as they get back out onto the street. And frankly, with Senate Bill 48, they're not going into a facility or anything else. And so what 4002 gives us is it gives us the ability to address the actual root cause of what's going on. I'm sure the DA will talk about Restore Court and what Marion County has done along those lines to truly look at how do we find a new and a better solution to this problem. But that's what law enforcement now has. This is, and I'll use the DA's word, it's not a panacea. It is not an overnight solution, but what this is just tools. And it is tools for us to find better ways to figure out what pathway we can get people into treatment. And when we're looking at treatment, we're not only trying to improve the lives of that individual for whatever reasons that they're now in the situation that they're in, but ultimately we're also improving that livability for the communities. We are getting the people off of the doorsteps of our businesses. We have created businesses now that are literally behind glass because of the theft issue. And so we're trying to address those issues, which I think are really important when we talk about this big issue within the community, because not everybody sees the overdoses that are happening.
Right.
Yeah.
My law enforcement officers have largely become medics as much as they've become law enforcement because of the overdoses. But I want to still be able to focus on some of those other underlying issues that we are now have better tools to address.
Well, good. You mentioned getting into treatment. Law enforcement is a gateway to get people into treatment. And we have Ryan, maybe you could talk a little bit about some of the processes and things that you've set up in the Health and Human Services Department.
Yeah, and then also to go back again, because prior to Measure 110, the most underfunded aspect of healthcare was really addiction treatment services. We had a huge need across the state of Oregon for access to substance use treatment, and we had very little capacity. So what Measure 110 got right was it did get a financial investment into the systems. The challenges occurred when treatment providers built up capacity, we were here ready to serve, and we weren't seeing the referrals, because what happened was then suddenly the connection that we had had for decades with law enforcement and with pathways into treatment, that was one of our largest referral sources, and those referral sources were discontinued now because social norms and behaviors were allowed to proceed where the use of substances were allowed and normalized. And so what House Bill 4002 has done is it's created that pathway into treatment again. It's created, we see deflection as really a referral source on the treatment side, and we have providers that have been built up over these past few years and have the capacity to serve, and we're really looking forward to seeing how Restore Court and how LEAD and the other deflection avenues will allow people to get the services and work towards recovery, and really that's what the outcome is. I think one of the things that often is misunderstood is that law enforcement and the healthcare system really have the same outcomes. We want the same results for people. We want people to get the services and supports that they need, and we want to be able to sort of provide those referrals in that direction to support individuals in need and have them live purposeful, healthy lives, on the back end. And I think that the better that healthcare and law enforcement can partner, and this is a House Bill 4002 really requires that partnership, and it's something that Marion County is already doing and has been doing for decades, and I think really put us ahead of the game when it came to that. So I know I'm really appreciative of the support from our district attorney, from our sheriff, and really from the commissioners in making sure that we have the infrastructure in place to where we can provide these referrals, we can have these warm handoffs, and we've already been able to get people into service from this House Bill 4002 that otherwise would not have been in services right now. Yeah. And so it's going to lead to tremendous outcomes for those individuals and for the lives they're going to get to lead.
Yeah, sure, Cameron. Ryan said something really important that I kind of want you to reiterate, because I think this is really an important thing to educate our community about, which is before Measure 110, a lot of the referrals that you got to get folks into treatment came from law enforcement.
Yes.
And I think that's misunderstood, and especially I think a lot of folks who are proponents of Measure 110, proponents of legalizing drugs in our community, the reason they gave was they said, we want people to get into treatment, not jail. And I think the underlying assumption is that when the police are involved, they don't get people into treatment. And that wasn't true in our community. And in fact, the opposite happened. What we saw is when they legalized the drugs, the number of referrals to drug treatment, to Health and Human Services actually went down, because now the local police officers weren't able to connect people with services. Right. So I just want to really reiterate that, because I think it's really important that people understand that law enforcement historically has been a really strong source of referrals in a way that people get connected with drug and alcohol treatment, and that continues with House Bill 4002, with the repeal of Measure 110. We're able to kind of rebuild that system where law enforcement is able to connect people to services.
Yeah. The other thing you mentioned, Ryan, was that Marion County has been doing this for a long time as far as working together. And I want to go back to Paige, and you referred to the Restore Court and you referred to LEAD, and talk about how the one group that's not here is our judges across the street
Right.
and the courts, and you can talk a little bit about how they all work together to get us to where
Right.
we're
So
at.
House Bill 4002 created a couple of different things, right? It created, it recriminalized, which we've talked about, but it really created this term that we didn't used to use. It was called deflection. And the real idea behind deflection is to keep people out of the criminal justice system, to instead connect them to services and not even have them appear in front of a judge, not even have that file cross my desk in a way that I have to deal with that. The upside of Marion County is we had been doing deflection. We'd been calling it diversion, but we'd been doing deflection for almost a decade prior to the passage of 4002, and that's law enforcement assisted diversion. That is exactly what deflection is. It is deflecting individuals out of the primary criminal justice system, out of a very costly, resource-heavy court system, and around that into treatment through our health department, into healthy lives. We use officers on the street to do that, and we call navigators directly, who are folks with lived experience. These individuals can do in 5 minutes what someone with a gun and a badge can't do in 5 years. There is rapport that is gained on those streets and trust. And those navigators help them get into healthier lives and really serve as motivators, as coaches, as cheerleaders, until individuals can find that within themselves. We've been doing that forever, really successfully, so successfully that all of us testified in front of the legislature to try to help other communities like ours do the same thing. Because we were so good at that already, we had to take that 4002 inspiration and that money that was coming to our counties and try to find other ways to be good with it and to help our communities. Expanding lead was one of those ways. The sheriff is doing that. We expanded all kinds of other services so we can continue to deflect. The other thing we did is we decided to be another pilot for the state, and we decided to create what we are calling Restore Court. So this is like deflection plus, because it's not really deflecting through the actual criminal justice system, but is helping individuals use the court system to get better and deflect themselves in the future. Restore Court stands for Restitution and Treatment en route to Expunction or Expungement, which is the clearing of one's record. What this does is takes individuals who otherwise wouldn't be eligible for lead because they have harmed the property of another person. So they owe restitution. They owe money to their victim for a broken window or a broken car door or a punched ignition or a stolen vehicle. They owe money, so we have to use the regular criminal justice system in order to make that victim whole. We took those individuals who we couldn't deflect otherwise and lead, and we're putting them into Restore Court. And the idea is let them get treatment, let them get housing, move them towards those programs, and allow them to work on Restore crews, which will earn money, which goes directly to the victims that they have harmed. The community benefits in a lot of ways. One, we get some service out of them. Think park cleanup or graffiti abatement. We also get them serving their communities and giving back in a way that maybe they haven't had the ability to do before. And they are making their victim whole in a way that maybe they didn't have the ability to do if they were sick, addicted, homeless, and jobless. This gives them an opportunity to fix things they couldn't have fixed on their own. And we partnered with the courts who were willing to set up this docket and help us do it. We just started in September with the passage of this law, but we already have about 8 people.
We have 10.
We have 10 as of yesterday. Ryan's keeping even better records than I am. 10 people in Restore Court, about another dozen that are considering it because they have a lawyer and they have to assess that it works for them in their lives. But these are really positive numbers in just a couple of months running a completely unique docket. This doesn't exist anywhere else in the state of Oregon. The payoff for the offender is not just giving back to their community, paying their victim. If they are successful, if they complete treatment, if they pay off their victim through restitution, we will expunge their record of everything that had to do with that criminal offense, meaning they can go forward in their life, much like LEAD lets them to do. They can go forward without the burden or the albatross of a criminal conviction when they apply for jobs or they try to get housing. It's a big deal, and it's something that isn't happening anywhere else.
So one of the questions that I think is really important, and Commissioner Bethell, maybe you and the sheriff could even answer this, is how, as we're speaking here to the community, how can the community get involved, and what can they do to help their neighbors, help us with this particular mission that we're trying to do? And Sheriff, I don't know if you want to try to tackle that.
I'm happy to, and I want to look at this also. There's one more thing that I think is really important when we're talking to the community right now. So what Marion County ended up being a champion for was to break down the stigma. And there was a stigma that compassion and accountability are two separate things. And really what Marion County has demonstrated and what we have done very well is to show that compassion and accountability are synonymous. And we want to be compassionate. We want to get folks into treatment. Getting them through treatment is how we get them better. And Ryan kind of brought it up when he was talking about being pro-social into the community and giving back into the community. And what we realize is that there has to be a level of accountability to do that. The DA opened the door, so I feel like I can walk into it now because she used the terms rapport and trust. And behavioral change comes from that rapport leading to influence and persuasion. You cannot simply just tell somebody to do something. They have to want to do something for themselves. But we have the ability, through using accountability, to work through building that rapport through LEAD, through Restore Court, through other resources, to get to that influence and persuasion and find that person when they are in the acute problem, meaning they are ready right now for change. And that's where Ryan's team has done such a good job, is that my LEAD folks have the ability that the time that we come into contact with them, we can actually do a warm handoff right into services with Ryan's folks. So there's not a gap in between where I'm not sure if this is what I want to do today because it may not be what I want to do tomorrow. We are actually serving that community by saying, here's your options, here's what we can do for you, and then handing them right off into those resources, which is an extremely positive thing. So when we talk about the community, Commissioner, and your question, one, I think things like this are good. The community being educated about what is happening. And so we're not sort of anecdotally trying to figure out, is this a good thing or a bad thing? The information is out there. We have multiple community groups, other places where we have spoken of this and are more than happy to come talk about this to help educate the community, because with the community being educated, we're also looking for the community to get involved. And so we have reached a point, and it's almost a fallout of Measure 110 where the community wasn't reporting things to us anymore. They weren't engaging with law enforcement because they didn't believe anything would happen. And the Restore Court is a classic example. The word restitution became this foreign word and nobody ever expected it. But in Marion County, we've got ways to address that. But what we need is we need the community to participate. We need them to report when things are going on. We need them to engage with us and be educated in that space so that we are all working towards rebuilding and sort of extending the livability here in Marion County.
You want to add to that, Commissioner?
Yeah, I think the sheriff has it right when it comes to being aware of what's going on in the surroundings of us. But I also think it's important to ask the community to have some grace and patience. We didn't, as elected officials, with the exception of Ryan, create the problem that we're navigating, but we are responding to the problem as efficiently and as diligently as we can. And we still have some restrictions around our wants as elected leaders and administrator of the health department because of state law. We're going to be navigating some of that in the legislature. One of the things that I want the public to understand is that their voice matters. So through that grace and patience process is to be informed and to plug into these conversations, your neighborhood associations, your city councils, and lean into those elected officials and ask them how you can actually participate in the change and then be a part of the change. Every single one of us, every single day, sees somebody in crisis, whether it's a mental health crisis, a drug crisis, a poverty crisis, a homeless crisis, a co-occurring crisis. And we all have to take our own responsibility in that space and figure out how we can be an observer with a report or somebody that can engage. We have a very robust health system here in Marion County that anybody can call. But if you're somebody who's navigating any type of a crisis, you can call either our Psychiatric Crisis Center, which will be rebranded in 2025 to the Behavioral Health Crisis Center, and ask for help. You can look up the Marion County Health Department and you can call a phone number, choose one, there's many, and they'll route you to the avenue that meets the path that you're on, and help people reduce the stigma of substance use. a lot of what we're dealing with in our community is substance use driven. And it seems to draw a shameful stigma because people don't want to talk about it. They don't, whether they're the user or a family of a user. And we want to draw that out because the only way we can solve this problem is together and with people who are brave enough to step forward and make the call. And it's either calling non-emergency, because not everything is a 911 emergency. Every time we see a circumstance happening in our community that's unhealthy, calling the non-emergency number is helpful to law enforcement and to us because we can collect data. We use that dispatch system of data collection to be able to address funds to a particular need. If we don't know it exists, we can't address it. So as people get frustrated, and I'm one of those people who has been very frustrated for some time, I now know that I need to say something, because if I don't say something, nothing happens.
You got called out there at the beginning of her. I was just, you and I kind of raised eyebrows.
The way that was phrased,
Right.
it was though.
She just meant he's not an elected official. Not that he's
Yes,
created a crisis.
but it was, as elected officials, other than me, you didn't cause the problem. That's sort of how it was phrased.
I thought you were the one that caused the
I
problem.
know, that was what I was like, wow.
When
Okay.
I said we were going to defer to
that's-
Ryan,
we
that's
just-
not exactly what I meant.
Actually, I was probably complimenting him that he is not
Exactly.
an elected
So yeah,
official.
just to
So
be clear,
you're
we're all
welcome.
It was
for
interesting
elected.
phrasing. I was like, wait, what was
Sorry
that?
about that.
And Ryan did not cause the problem.
Yeah.
That's
Not
on the
my
record.
intention.
Yeah.
Okay. All right.
I think it is a good point, though, Commissioner, that we are frustrated as well.
Yeah.
I think one of the things that I want to share with our community is how lucky we are to have some of the public servants that we have here in Marion County. You've dedicated your entire career to this community. You've dedicated your entire career to this community. Your teams have. I think that the more that I've gotten to know the folks that do public safety in this community, the more that I'm just so grateful for literally the decades of service. And you don't get recognized. It's not like people, you're not the front page of the newspaper. People don't know all the hours that you put in. And I think the same thing is true for your team, Ryan. I think the more that I've gotten to know the folks who work in our alcohol and drug treatment services, like these people have literally dedicated their lives to helping folks get better. And I think one of the things that I've also realized is people do get better. And I think that can be really hard because some people don't. I think we have to recognize that there are some folks suffering for addiction. I have some family members who end up dying in their addiction, right? They don't get better. It's been a wonderful experience for me to meet people who have gotten better. And I remember talking to somebody who said, well, how do you know? And I was like, well, because I've worked with them for 6 years, and like they do great work, and they'll be the first to tell you I'm in recovery, or I am an addict. They say I am an addict in recovery. And I've worked with some of these people for 6 years now as a commissioner, and just see the dedication they have to pulling other people out of that life. And so I think that's important to recognize as well, that sometimes we're the most frustrated when something is broken at the state level, when we can't help people. I think that was the case of Measure 110. I mean, it's just heartbreaking for our officers to see somebody in crisis and know that they can't do anything because it's literally now against the law. And that's why we advocated so strongly for repealing Measure 110. And that's why we're working so hard to rebuild this system. I think that's an important part of this, because sometimes I think folks can say, oh, well, it's all broken, nothing's being done, and that couldn't be further from the truth. I mean, this team has been working really hard to put our community back together.
And one of the things I think is important to remember, too, is that even after 110, it wasn't like we hung it up and said there's nothing that we can do.
Right.
So LEAD, in the passage of 110, what we ended up doing was building a very robust social network. We ended up going to our social referrals because that's what we could do. And so we, the LEAD coordinator, ended up working with the hospitals. And so we've got all new programs now where the ERs have the ability to refer back into LEAD, which never existed before, but they know how to make those phone calls now. And so we have found ways to continue to work. It's great what we're getting out of 4002, and it's given us additional tools. But one thing I appreciate about Marion County is we didn't just look at it, turn our backs, and say there's nothing that we can do.
Right.
We continued to find ways to work through no matter what the challenge was. And in the end, we have a more robust program now because that social referral system still continues even though we now have this deflection and we're now working through that coming out of 4002. So I think that's also something of note is what we've done.
I do think it's important, though, to say that we've said everyone's talked a lot about the success and the good work that we've done here the whole time, but the issue has exacerbated itself, not just because of Measure 110. COVID created a fair amount of harm for our community. The cost of housing, some would say the lack of housing. We have a lot of different social determinants of health. That's what the legislature's flashy phrase is, to kind of point a finger at the different types of crisis that we're experiencing in our communities. And I heard recently, I sit on the Homeless Alliance board, and I was talking to one of our service providers, and the way she described Measure 110 is it made it a landlord problem to a community problem. Because what was happening behind closed doors pre-Measure 110 fell into the community because it made it acceptable to be doing drugs in the open air space. And then it brought attention to it for vulnerable populations to be able to reach it easier. So the concept for the space that we're in now and the number of individuals that are in crisis is exceptionally higher than it was pre-Measure 110. And we had an issue before Measure 110. And so when I ask about patience and grace from the community, it's because while Marion County, because of its very collaborative system, has been doing good work all along, the reach around to be able to grasp the problem is, I can't connect my fingers, if you will, on the reach, because it's so big. And it's going to take every organization in our county, the city councils, the police agencies, and the state, to be able to finally get a handle on it. And it's going to take time. But the problem is huge. And I think people are expecting, in fact, I know people are expecting that we've recriminalized it in February. How come it's not solved by the next February a year later? And I don't know which commissioner it was, but one of you once said to me in the very beginning that what should take a month takes a year, what takes a year takes 10 years, or some analogy of the sorts in government, and that is exceptionally frustrating for us. It probably was you. And I'm probably the most impatient person sitting on this panel, and I've had to just understand that some of the smartest people in Oregon are in this county doing the work and designing systems very collaboratively. It's not done in a vacuum. I was in a meeting earlier today talking about the community connection meeting that happens at Salem Police every single month. And the number of individuals from community-based organizations, from state agencies, from law enforcement, et cetera, that come. Today I was told there was over 48 organizations at the very last meeting collaborating on solutions to figure out how to make our communities livable.
One of the ways that I think about this, Commissioner, is it's like if you're in a boat that has a big hole in the bottom, right? That was what Measure 110 did, is it punched a big hole in the bottom of our boat and a bunch of water got in. And while that water was coming in, the sheriff and DA, the health department, they were trying to bail that water out as fast as they could, but the water was coming in fast so they could bail it out, right? There's still lots of problems in our criminal justice system. There's still things that we need to fix. So I would say the hole is now partially patched. There's still some water coming in, a lot less than used to be coming in, but the boat is now filled with water. So even though the hole is partially patched, even though Measure 110 is repealed, all that damage that was done is what we have to work our way out of. And it's going to take us a while to get that water out of the boat to get us seaworthy again.
I want to go to two things that have been mentioned that are still on the top that I really appreciate. Sheriff, you said people's lives have been changed. And if somebody is watching today, if you've never come to one of our second chance breakfasts, you always get to hear these stories of people whose lives have changed as a result of the compassion and the accountability that showed. And then the other one that Ryan, you mentioned the money. The one thing about Measure 110 was the money flowed. You share a little bit about how that helped us when we set up different resources and some of the nonprofits that are, besides your department.
Sure.
We have other partners in the community to help with this.
We do. We have other outpatient providers that have been able to increase with the Measure 110 funding. So we have Ideal Options, we have Bridgeway Recovery Services, and then there's a few others like Pathfinder and others that are a little bit more narrow in terms of the scope of the services. But in terms of significant outpatient services, Ideal Options, Bridgeway, and then the Marion County are the three largest providers. I think Marion County saw an influx of about $25 million to go to build capacity over these last 4 years for addiction treatment services across our county. That was massive. That really allowed people to increase FTE, increase residential beds. We have increased detox capacity. We're building sobering resources, in our community now. So a lot of the areas that over the last 5 to 10 years we had identified as being insufficient to meet the demand, we've been building up and we've made those investments. And now, we obviously have more pathways into those services for the individuals that we are deflecting. One of the things I do think we need to mention is that really there still are individual choices. As much as we want to suggest that people make different life choices and change behaviors, they have to consent to treatment. They have to consent to go along that path. And oftentimes people are going to start that recovery process and they're going to fail, and they're going to come back in a future date, and they need to sort of have permission to attempt it and fail and attempt it and fail again until ultimately it's going to hopefully take hold and people are going to be able to change their life for the better. But I know that from a community perspective, you often see individuals and you think, well, why can't the healthcare system do something, or why can't law enforcement do something to help those individuals? And while we can incentivize choices, which is really what this Restore Court is, it's like an incentivized choice of, hey, look at all the benefits if you choose treatment, and how it can benefit you in terms of your criminal record or in terms of what resources you can achieve. But at the end of the day, it's up to them. They have to make that choice. They have to be willing to make that choice. We can't force it upon someone. But all we can be in terms of the addiction treatment providers in our community is we can be there with open arms to embrace people when they're willing to make that change. And we can offer the types of supports and services that they're going to need, whether that is a peer walking alongside them, whether that is, a certified addiction treatment counselor to give them therapy, whatever. Whether that's a bilingual employee because you need bilingual, bicultural, whatever it is that's that safe space, that welcoming space that individual wants to walk in and they feel comfortable with. And whether that's Marion County as a provider or Bridgeway or Ideal Options or others, we want to give people an array of services that they can choose from. We want to be there where there's no wrong door for people to walk into, and want to help them get the help that they need and ultimately get the outcome to achieve a life of recovery. And then, as you sort of mentioned, Commissioner, a lot of people in the workspace are people that have lived that life. And that's what's so interesting is how many people want to pay it forward. Like so many of our employees are people that went through those struggles. They created a bond with a peer or a counselor. They saw how their life changed and they wanted to pay that forward to the next generation of people. And we have so many workers that come with that heart and with that mindset to the work every day. And I think that really is something that if people are willing to take that leap, I think they'll see that it's really welcoming for people because they understand the shoes that they're walking in. They understand the path that's in front of them, and they're going to do whatever they can to support them.
Yeah, it's interesting you said that about maybe failing, and of course we call it the second chance breakfast. You listen to some of those testimonies that are those people that are giving back now. Yeah. It took them many attempts to get there.
Just don't give up.
Good point, right? Yeah, I'm sorry.
Yeah, no, it's okay. I just wanted to. Could you unpack a little bit the $25 million, because I think it's important for the community to understand that Marion County, the government, didn't receive $25 million to do.
It was the region.
Right, and there's, we set up the Behavioral Health Resource Network. We call it the BURN Network. Do you want to talk a little bit about what that looks like and how the county, the government county, is really leaning into partnerships with community-based organizations and how that system works?
Yeah, so all 7 organizations that received a component of that $25 million, we meet regularly. They meet monthly as a group, ongoing, to kind of share resources, share referral pathways, make sure that we're understanding the service array from all the different providers. A lot of that $25 million went to residential beds. Bridgeway, for example, was able to open an additional home, and so that was great. Marion County, specifically in terms of the Marion County government entity and the Health and Human Services, we received a little over $6 million for that 4 years, which allowed us to add FTE, add increased capacity to be able to staff the Restore Court and to be able to do a lot of the other work that we're doing and increase services up in Woodburn and in Salem. But yeah, the other providers also were able to build more residential capacity, more homes. We also had a grant process with with our burn, where we had community partners that were able to apply for grants. We've been able to get involved organizations like Soaring Heights in that as well. And so even though there aren't original burn partners, we've sort of been able to expand that network beyond that to get as many, again, we want as many doors for people to open as possible, and have that variety of services. At Marion County specifically, we have medication-assisted treatment, so we offer methadone and Suboxone. We have outpatient services. We provide assessments. We respond to hospitals when there's an overdose in the emergency department to provide follow-up and counseling, and again, try to engage people in treatment sort of at their lowest point. So we try to offer a full spectrum of services, and I know we've got other providers, that are doing the same. And then we try to partner as best we can to make sure that the appropriate provider is available to provide that service to the individual.
And then the funds they're a little flexible and I say a little flexible. It turns out that addiction or substance use doesn't pick up a class of people. It could be any person. And there are barriers to the gamut of individuals trying to navigate substance use recovery. And some of the things that I've learned just in the last couple of years is that the pathways that make it very difficult because of the cost for substance use recovery to exist. And Oregon's really great at creating these gaps in the systems. And so the burn funding, that's what we call it, that we house allows folks who might make a little too much money to be on Medicaid or don't qualify for Medicaid at all to be able to access treatment, so we can have a service system available to anybody that is a resident of Marion County seeking treatment.
Yep.
And that's actually huge. And this is going to air in probably different segments as our PR team puts it out there. But one of the things that I'll be advocating for at the legislature this coming year is to maintain the consistency of that funding into counties, so we can maintain the system of treatment that we've created and enhance it, because it will need to be enhanced. And of course, secondarily, add juveniles into the conversation, which we've already done. We've already started that work. It was completely eliminated from House Bill 4002 with an after statement that we'll get to kids in 2025. And so now we're going to be working on juveniles in 2025 and substance use disorder. And again, Marion County is leading the conversation in that space very aggressively, because it's one of our priorities to make sure that everybody that lives in this community can have access to treatment when they want it and need it.
One of the things that you said, Ryan, that I thought, again, was really important for kind of thinking about this problem is, I think most of us who have had family members or friends who have struggled with addiction know that there's sometimes can be this process of somebody entering into treatment, failing, not succeeding, and then trying to do it again and not succeeding. And I think one of the questions you can have is, well, how do you know that you're actually, as you said, incentivizing people towards treatment and towards behavioral change rather than not? How do you know that it's not just a revolving door? And I think one of the things that I really appreciate about this group is that I think it starts with a conviction that substance abuse is not compatible with human flourishing. I think that's actually a really important conviction, that substance abuse is not compatible with the people that we care about in our community flourishing. And so we're going to orient our system, whether it's our criminal justice system, our health system, our government system, in a way that says we're going to try to disincentivize substance abuse. We're going to try to make it harder for people to use substances, and we're going to try to make it easier for people to get into treatment. I think that's really sort of philosophically kind of what we're doing here. And Measure 110 did the opposite. It made it easier for people to abuse drugs than to get into treatment. And I think that sort of paradigm shift is really important, and everything kind of hangs together on that. That's why we try to make it as easy as possible to get into treatment. That's why it's important that law enforcement can connect people to treatment and can interact with folks when they're struggling with substance abuse. That's kind of the structure that we can build this system on, and that's part of the reason we've been successful.
Great. Anything we want to wrap up with? I know we've been sharing a lot. Any last comments?
I'd just like to wrap up by saying that reading the bill, House Bill 4002, from the February 2024 session is pretty simple read. It's actually not the longest page piece of legislation I've ever seen, but it's also really complicated because it has a lot of shoot-offs and avenues that don't make sense to the average person, which is why all of us are sitting in this space working together to make sure it's designed to meet the needs of our community. Every county had to agree to participate with the way they wanted to participate. This isn't a bill that says you must take this model and deploy it. You do have to meet certain criteria of the law. But what we're doing here is very unique. And there is some stick to the process of House Bill 4002, which is super important because as Ryan said, sometimes people do fail out, and sometimes they need some more incentive through the criminal justice system to be accountable to themselves. And I think that there's conflicting feelings in that space, but I'm grateful for the team that we have here in our district attorney's office and our sheriff's office. And if folks aren't already following the Marion County Sheriff's Office social media sites, I would encourage you to, because they are showcasing a lot of good work that's being done in the streets of Marion County on behalf of citizens. And a lot of that is drug removal and gun removal. Because of House Bill 4002, those tools that have been returned to you allows officers to be more proactive in responding to the calls they're now receiving again, and bringing drug dealers off the streets and putting them in jail. Thank you, DA Clarkson, for your team being very proactive in that space. We don't want harmful people preying on victims in our communities. And I would say that we've seen, as of late, an uptick in real policing that the community expects to see. And I think as we get stronger footing in this space and the community gets more comfortable realizing that your tools have been returned, I think we'll see more calls coming in, frankly, of requests for a response from law enforcement, and then these systems will become really full and productive.
Yeah.
Well, I know I speak for the sheriff, and I don't do that very often, but I'll say it here. I think we are really grateful to work in a county that understands what crime is, what public safety is, and what health means for our community. And we have been very clear from the beginning of House Bill 4002 that if you are preying upon individuals in our community, if you are selling drugs, if you are peddling wares that hurt people, we will do our level best to send you to prison. But if you want treatment and you are someone that wants to walk through a door and you are sick, we will get you the help that you want. Yeah. We will get you to yes, we will open that door, and we can just be the path to get you to Ryan and his folks. And that comes from the leadership in this community, that comes from commissioners that understand what this means to have a healthy community. So we're grateful to live here and work here.
I couldn't have closed this any better than that.
Well said, well said.
Well said.
Well, thank you, everybody, for participating in the conversation and the work that we do here.
Thanks for having us.
Yeah.
Thank you.
Very good.